Good afternoon, everyone. I'm really very pleased to be here this afternoon to introduce this special presentation of the Integrative Medicine Research Seminar Series. And it's being done today on April 11th in recognition of World Tai Chi and Qigong Day. The presentation will be on Tai Chi for health, the current state of the research and the challenges ahead. And I think that this particular topic is just so reflective of the mission of the Osher Center for Integrative Medicine. They really believe that their commitment and actually their responsibility is to evaluate integrative therapies with the same scientific rigor that we would if we were evaluating a drug for the prevention of heart disease or a new treatment or a new surgery for the treatment of back pain. And so what's going to happen today is that there will be 3 mini lectures that are very interrelated and very complementary to each other. They'll be given by 3 Harvard Medical School researchers, and in particular Dr. Peter Wayne, Dr. Gloria Ye, and Dr. Helen Langeval. And they've got complementary areas in which their research is focused. Dr. Wayne is in mind-body exercise, but with a focus in neuromuscular skeletal health. Dr. Ye is also interested in doing research in mind-body exercise, but her particular focus is cardiovascular and respiratory diseases. And Dr. Langeval is also interested in doing research in mind-body exercise, but in particular the mechanism that underlies it, in particular connective tissue. So what we're going to do is have 3 mini lectures, 15 minutes each, and then we'll have a question and answer period at the end. And I think this is something you're really going to enjoy a lot. So I'd like to begin by introducing Dr. Peter Wayne. Dr. Wayne is an assistant professor at Harvard Medical School, and he is the director of research at the Osher Center for Integrative Medicine. Dr. Wayne.
Thank you, Julie. So nice to have such a nice turnout and to see so many friends in the audience. Thank you all for coming. So what I wanted to do today in our brief talk is say a little bit about what Tai Chi is and maybe some of the challenges of studying Tai Chi from a scientific perspective. Give you a very broad overview of who's using it and as a result why we're studying it, and the overall state of research of Tai Chi for health. Then I was going to talk specifically about Tai Chi for fall prevention and balance, and to summarize the research to date in that topic, and then give you a specific example of one of the studies that Dr. Ye and Dr. Buring and other people in this room have collaborated on, looking at Tai Chi to prevent fractures in women with thinning bones. And finally, I want to just give you a very broad 10,000-foot view of the portfolio of research that we're doing here around musculoskeletal disease and Tai Chi. So one of the first challenges that we come across studying Tai Chi from a scientific perspective is simply defining it. What is Tai Chi? Now, in contrast to some of the work that Dr. Buring does, for example, studying aspirin for cardiovascular health, where we have a very known active ingredient in aspirin and a pretty good sense of what physiological pathways this active ingredient targets. In contrast to that, in Tai Chi, we're not really sure what the active ingredients are. In fact, we think there's many, more than one. And we don't really understand fully what the physiological pathways or mechanisms through which Tai Chi has its therapeutic effects. To complicate things, Tai Chi is not Tai Chi. There are many different styles, all which differ in their emphasis on principles to some degree. And that's why I have this light bulb up on the slide. It reminds me of a Tai Chi joke. How many Tai Chi players does it take to change a light bulb? The answer, of course, is 100. 1 to change the bulb and the other 99 to say, we don't do it that way in our style. But that pluralism does raise some real challenges for our research, which makes it very different than pharmacological research or other well-defined Western therapies. But we do have a working definition that we use in our group, and that's that Tai Chi is an exercise that's rooted, we know, in multiple Asian traditions, including the martial arts, traditional Chinese medicine and philosophy. And the training aims to integrate slow, intentional movements with breathing, and a variety of cognitive components, which include focused or heightened focus attention of the body, body awareness, mindfulness, and imagery. And the overall goals here are to strengthen, relax, and integrate the body and mind, and thereby enhance what the Chinese might call the flow of internal energy, or qi, and thereby improve health, personal awareness and development, and also in some systems, Tai Chi is considered a martial art, so self-defense. So one of the key motivating forces that has led to us having a robust research program here is that Tai Chi is becoming increasingly popular. This is an image from the Boston Globe a few years ago. And actually, there isn't great up-to-date data on the prevalence of use to Tai Chi. The most comprehensive survey was completed in 2007, and at that time, it was estimated that 40 million Americans were using mind-body therapies for health. That's just for health, so that even then was an underestimate. In particular, about 3 million of those people were using Tai Chi and Qigong, and that compared to about twice as many who were practicing yoga. What was remarkable is those people were spending over $4 billion out of their pocket on these therapies for health purposes alone. And not surprisingly, it becomes very important for institutions like the National Institute of Health and scientists like medical scientists at the Harvard Medical School to devote some focus to that. Are people using their resources effectively? Are there some therapies here that can complement what we already know from conventional medicine? Is it safe? So Tai Chi and mind-body is actually a high priority area for funding institutions like the NIH. So Dr. Ye and I maintain a database here at the Harvard Medical School where we keep close track of all the publications that are done in Tai Chi. This is a graph here. Let's see if this works. Showing you that there's basically been an exponential growth in the number of studies over the past 20 or 25 years in Tai Chi. To date, we estimate now that there's over 750 peer-reviewed scientific studies on Tai Chi just in the English language alone. And obviously there's many more in Asia and other languages. And what's remarkable about this progress is that more than 175 of these studies are what are called randomized controlled trials, which are rigorous methodological approaches that minimize bias. So there's quite a bit that's been done, and that surprises a lot of our colleagues when we share this information. This is the 10,000-foot view of what kind of research has been done. These are a summary of the major areas where randomized controlled trials have been focused to study the effects of Tai Chi. And the most common area, and one I'll talk a little bit about, is on fall prevention and balance in older adults. There are little asterisks here. Those asterisks refer to areas of studies that have actually multiple studies that have been summarized with either systematic reviews or meta-analyses to create a gross estimate of the effect. And the places where there are asterisks also suggest that there's positive data. So we know now that there's good data, and I'll share some of this for Tai Chi and balance. Dr. Ye is going to talk about cardiovascular health, and there's quite a bit of research in that area. We've been doing some work in bone health and osteoporosis, and that's been summarized in other studies. There's some nice work. Dr. Wong is here from New England Medical Center, and she's been one of the leaders in rheumatological conditions, osteoarthritis and rheumatoid arthritis, and she's summarized some of those in lovely meta-analyses. And there's some other areas that you can see in here where there's mounting evidence. A lot of this evidence is limited. Many of these studies are smaller, there's methodological issues, but there's a growing number of studies, and our group here across the Harvard Medical School is trying to build on that evidence. So what do we know about Tai Chi and for balance and fall prevention? One of the best, well, let me just say a little bit about why we're studying that. I think most people here know that fall prevention is actually a very significant public health issue. About 1/3 of older adults over 65 have a chance, 1 out of 3 chance of falling within that year. It's quite remarkable. And those falls often result in very serious injuries, fractures, traumas, and other serious medical conditions. Just thinking about hip fractures alone, it's quite scary. An older woman with a hip fracture has a 20% increased likelihood of dying that year We're not talking about just serious medical injuries and rehabilitation, but the risk of death goes up by 20%. And that's not due to the fracture, but the sequelae, all the side effects afterwards, being able to care for yourself, changes in social activities and things like that. And not surprisingly, those costs are quite high to individuals, to their families, and to society. It was estimated that in 2010, over $28 billion are devoted to dealing with falls and fractures. So this becomes a very important area to study, and Tai Chi shows some promise there, so people are interested in that. The best data on this has been summarized by some researchers in the Netherlands, Loog's group here, and they did a meta-analysis of all the research that was available in 2010. At that time, they found 15 randomized trials, and they said only 7 of those were higher quality, so they focused their analysis on that. Their most, I think, rigorous test of Tai Chi is when you compare Tai Chi to another active exercise. And there were 2 large studies, or moderately large studies, in focusing on Tai Chi versus other exercises. And what they found was that Tai Chi can reduce falls by up to 49% on average. That's a very significant effect. When they looked at how Tai Chi compared to other control groups, non-exercise control groups, there was still an effect there, about 21%, but this effect was not as significant. There was quite a bit of variability across the studies. Since then, there's been a few other studies that have been published. My review of the literature recently suggests about 5 new studies. And 3 of those studies, one looking at Parkinson's disease, one looking at stroke survivors, and one looking at frail elders, all add further support that Tai Chi may help reduce fall rates. So I think it's fair to conclude that there's pretty good evidence, not inconclusive, not unequivocal, but good evidence to suggest that Tai Chi may be a promising intervention for reducing falls. So what is it about Tai Chi that has this therapeutic effect? And one of the things our group is very interested in is the fact that Tai Chi has multiple components, or to use the language of conventional medicine, multiple active ingredients. And it's this package of therapeutic components that may enter the health of a body or intervene with the health in multiple ways, bringing it back to a better state of health. And some of the ways that we think that Tai Chi, and there's actually quite a bit of data for this, is that there are many risk factors that Tai Chi might impact. For example, we know that Tai Chi from well-designed randomized trials is weight-bearing and it increases leg strength, right? So we know that leg strength reduces the risks of falls and improves balance. We also know that Tai Chi seems to improve various sensory deficits, in particular proprioception, the sensitivity of the soles of the feet, or plantar sensation. So that increased sensation in the sole of the feet gives the body feedback as to which way it's moving and how to adapt to those changes. And there are a number of good studies that support improved sensory perception in the feet and even in the hands. Neuromuscular coordination. There are a number of studies that have been done, randomized trials, where people are brought into a gait lab and they asked to walk down a runway, and that runway is unexpectedly moved, and people are induced to have a small slip, and they wear harnesses, it's safe. And from those studies, as well as other functional studies, how people arise from a chair, how they walk, we know that the coordination, the foot to the ankle to the knee to the hips, etc., is much better, and the reaction time and the reflexes seems to be better. So that neuromuscular coordination is another mechanism. Cognitive impairment is also an important risk factor, and there's a couple components to this. But one of them, and this is of great interest because Tai Chi is a mind-body exercise, not just a physical exercise. But one ironic aspect of fall risk is that one of the biggest predictors of a fall is fear of falling. So if you ever have watched an elderly person who's had a history of fall, a relative or a parent, there's a tentativeness with how they walk. There's a bracing, there's a holding of breath, there's a preoccupation with the possibility of falling, so they're not aware of where their body is in space and the environment around them. And we know that Tai Chi has a very good effect on reducing that anxiety, letting people feel a little bit more comfortable in their body, a little less fearful of falling, and that's been shown to be associated with decreased risk of fall following Tai Chi. There's also some mounting evidence that Tai Chi allows us to multitask a little bit, executive function. And we know that where our attention is also important. If you're walking on a cell phone, you're not as aware of where the curb is or a crack in the sidewalk. By training body, breath, and mind, Tai Chi seems to improve that cognitive function. And we have a systematic review on that we're just completing. Finally, as I mentioned before, and Dr. Wong has showed, Tai Chi can reduce various aspects of pain, osteoarthritis, rheumatoid arthritis, and we know that pain is a distractor. And taking pain medication can also lead to an increased risk of falls. So there are many different ways that Tai Chi might be impacting this. And this leads to something that I think Dr. Langeval is going to talk about, which is thinking of health in a more systems-oriented way and how Tai Chi as a multi-component intervention lends itself very well to that systems biology perspective. But there's still many gaps in our understanding of the impact of Tai Chi on balance. A lot of our studies are in much older adults. Some of the studies we're doing now with Hebrew Senior Life, for example, we have people in our trials that are in their 90s and close to 100 years old. We don't know whether quantitatively Tai Chi improves the balance of younger adults. And we don't know too much about other conditions, diabetic neuropathy, vestibular disease, MS, and other areas that impact balance. We don't know very much about bone health. There's some studies, but a lot more is needed. We don't know about the pluralism of Tai Chi. Is all Tai Chi the same? Is there differences between styles? And that's a challenging thing to study. And we don't know a lot about good large-scale physiological studies. And one last thing that we won't have time to talk about today, but we don't even have a concept of what a dose of Tai Chi is and how we would measure that. And that's one of the things our group is moving to study with a partnership with industry. So I just want to give you an example of what a trial looks like when we bring the tools of Western science and randomized trials and the tools that we have in laboratories to study this non-conventional intervention. So I'm going to talk a little bit about, very briefly, a trial on Tai Chi for women with thinning bones. And these women are what we call osteopenic. They're not quite full osteoporotic, but their bones are thinner than normal comparisons with healthy bones. Okay? And so this looks just like one of the trials that Dr. Buring would do with aspirin. We have women that are recruited with a very well-defined set of conditions. In this case, certain age range, 45 to 70, well-defined osteopenia. And they're randomized. In this case, they're randomized to receive the usual care that's recommended by their doctors, plus 9 months of Tai Chi. And what makes this study a little different is that Tai Chi was offered in the community. So women who were randomized to Tai Chi got to pick a school that was close to their home for a lot of reasons. We wanted to make a generalization about the impact of Tai Chi across all styles. So this is one way to deal with the pluralism. We also wanted to make it convenient. 9 months is probably one of the longest trials of Tai Chi in the West. We wanted these schools and their practice to be something that was convenient for them to attend on a regular basis. After randomization, we bring them into the laboratory. We have lots of measures. The ones I'll share with you are dual X-ray absorptometry, DEXA, scans of the bones for bone density, and some measures of balance. But we also have very sophisticated serum measures of bone turnover markers, measures of exercise behavior, quality of life, and many other things. So we measure that at baseline, and we follow them at 3 months, follow up at 3 months, and also at 9 months. And so we do our bone density measures just like we do in hospital clinics. People in this study use the DEXA lab at Beth Israel Deaconess Medical Hospital. And here I'll be showing you primarily the data on the femoral neck, but we also have data on the total hip and the total spine. And so that's what this slide shows. And really, I just want to give you a feel for the data. And this is a small study. It's 86 women, and 9 months is not a very long period of time to monitor bone health. Most drug trials for bones are about 2 years. So we didn't expect to see any significant effects in this trial. What we did in this pilot study was try to see if there's a trend and how big that trend was, and to use those data to design a future trial. So what we saw was a little bit surprising. in this cell here, we're seeing the women that were randomized to the usual care or the standard of care. And over the 9-month period, they lost about 1% of their bone. And that's expected. Postmenopausal women's estrogen levels are dropping. We know that's associated with bone loss, and that's why we did our study. Can we reduce the rate that they're losing their bones? Those women that were randomized to Tai Chi basically stabilized. This is everyone who went to Tai Chi, whether they practiced or not. They lost essentially 0. So something was happening there. But the women who did the most practice, that did 70% or more of attendance and practice, that what we call per protocol, actually had a modest gain of just close under 0.5%. And that difference between the what we call the per protocol and the usual care or standard care was actually statistically significant. And we saw similar trends that were not statistically significant in the hip and in the spine as well, with those who did the most Tai Chi showing the most attenuation of bone loss compared to those who did the least, or none. A complementary part to this study was to look at biomechanics and balance, and there are many aspects to this, but really thinning bones are only a problem if you fall. And so we were interested in whether Tai Chi also improves balance and risks of falls. Right? So we bring them into the motion lab, and this is our partners at Spalding Rehabilitation Hospital. This group was led by Dr. Paolo Bonato's group. And we wire them up with infrared sensors on their body and cameras all around the room. And what I'm going to show you is just one set of outcomes around what's called center pressure control or center of gravity control during quiet standing. So this is a diagram of the movement of the center of gravity in the body relative to the center of pressure between the feet. And the more you wobble, the more variable this stabilogram is. Right? So this is just a measure of sway. And these measures of sway I'll share with you, both the sway range and the speed of the sway have been correlated with the risks of falls in other studies. This shows you the sway of an average woman at baseline, 3 months and 6 months. And you can see as you move across here that the magnitude of that sway is reduced over time. And we can do statistics on the sway range, right, the average sway range and the speed, and that's what you see here. And very briefly, what you can see is those in the Tai Chi group that did the most practice showed the most decrease in sway, and those who were in the usual care actually were worsening in their balance. And even though this is a small study, we saw highly significant differences between the groups. So the conclusion from this small study is that doing a pragmatic study out in the community with long-term Tai Chi is feasible. We can recruit women, we can keep them in the trial, we can make the measurements, and that these trends are promising and are leading us to wanting to do a 2-year study, which we've submitted a grant that's being evaluated by NIH. Very briefly, we have a whole bunch of other studies going on. This was just one of them. We have a group that's very interested in systems biology and what we call complexity measures, the dynamics of physiological systems. And we have one study that we've just completed. Dr. Brad Manner has been looking at peripheral neuropathy in diabetic patients and how that changes both the sensation in the soles of the feet. Tai Chi impacts that, as well as overall balance and function. With Dr. Lipsitz at Hebrew Senior Life and BI, we're looking at frail elders in assisted living facilities and looking at balance, cardiovascular health, and we're almost finished with that study. We have some other studies with healthy aging, and that's an interesting study in that we're looking at whether Tai Chi can prevent disease as opposed to treating and rehabilitating people already with medical conditions. And in that study, in addition to comparing healthy individuals learning Tai Chi for 6 months, we're studying 30 Tai Chi masters and comparing their physiology to equivalent age-matched individuals. We've completed some studies with people with inner ear neurological problems, vestibular disease. We've started a small program on Tai Chi for Parkinson's disease in recently diagnosed people. And at the end of this presentation, we're going to show you one of the community-based classes that is linked to this research. And then, as I mentioned, we have some work we're doing with industry, trying to measure what good Tai Chi looks like and whether we can link that to dosage. So in conclusion, I think it's fair to say that Tai Chi is a promising intervention for fall prevention and postural control. The multiple components of Tai Chi, I think, afford unique therapeutic advantages, but they also pose some real challenges for research. Research to date is important. It's catalyzing how Tai Chi is integrated into communities. Right now, 4 or 5 of the hospitals across Harvard are teaching Tai Chi already. We're offering classes. Many of the teachers are in this room, and it's in many senior centers, and I think research is a really important bridge in this dialogue. And I think part of that bridge that's equally important, and that Dr. Langeval will speak to, and also Dr. Ye, is mechanistic research. It's not only does it work, but are there plausible mechanisms, physiological pathways that say, yes, this makes sense. And if we know those, maybe it'll help us combine Tai Chi with other therapies in a more integrative way. All this work takes villages of really smart and dedicated people, and there's no time to thank them all and acknowledge them, but I'm a very small part of this big team. So, and I also want to acknowledge the National Institute of Health for supporting our work. So thank you.
Thank you, Peter. Our next speaker, Dr. Gloria Ye, will talk about mind-body exercise for research in it, but with respect to cardiovascular disease and respiratory disease. Dr. Ye is an assistant professor at Harvard Medical School. She's also the director of the Harvard Medical School Research Training Fellowship Program in Complementary and Integrative Medicine. Dr. Ye?
Thank you very much for this special opportunity to speak with you this afternoon. So I'll just get started right away. So as you know, cardiovascular disease is a tremendous health burden, both in the United States as well as worldwide. In the US, cardiovascular disease accounts for 1 in every 3 deaths and is a huge cost to our system. So when we think about how Tai Chi may play a role in managing cardiovascular disease, it's helpful to consider the entire cardiovascular prevention spectrum, from primordial to primary prevention, where we think about managing cardiovascular risk factors, to secondary and tertiary prevention, where we think about managing cardiovascular disease further down the line. So going back to this wheel representation from Dr. Wayne's work, we know that Tai Chi is a multi-component intervention. It has components of physical activity, aerobic exercise, musculoskeletal strengthening and flexibility. But there's also an important component of breathing, as well as an important component of meditation and relaxation and stress management. And so these multiple components of Tai Chi have the potential to impact multiple physiological processes and these key modifiable risk factors for cardiovascular disease, such as physical inactivity, deconditioning, stress, anxiety, depression, blood pressure, and perhaps, although the literature is scarce in this area, perhaps lipids, glucose, or even inflammation. So how much exercise is Tai Chi? So the studies report that Tai Chi is somewhere between 1.5 to 4 metabolic equivalents. And this, on average, roughly speaking, is equivalent to brisk walking. And we know that even very modest, sustained lifestyle changes can substantially reduce cardiovascular morbidity and mortality. And so for most of our sedentary population, adopting a moderate intensity exercise such as Tai Chi for 30 minutes most days of the week can have tremendous health benefits. So there have been several studies looking at exercise capacity or cardiorespiratory fitness as an outcome in these Tai Chi studies. This is data from a meta-analysis including over 300 Tai Chi subjects. And if you look at the plots, if you look at the plot here, to the right of the midline the points are effect sizes that favor Tai Chi, and to the left favoring control. And although in these experimental studies, the overall effect size was relatively small and actually non-significant in these experimental studies when you're comparing Tai Chi to control. However, if you look at the cross-sectional studies, the overall effect size was much larger and more dramatic and significant. And these overall effect size actually vary as well, depending on whether you are comparing Tai Chi to an active exercise control or to usual care, with bigger effects seen when you're comparing Tai Chi practitioners to sedentary controls. A more recent randomized control trial actually supported some of these findings. It was actually a fairly large trial of 374 elders in Hong Kong, and they randomized patients to 12 weeks of Tai Chi versus 12 weeks of a walking group versus usual care. And they reported about 20% increases in exercise capacity that were similar in both of the exercise groups, both the Tai Chi and the walking, and both significantly more than the usual care. So perhaps arguably more important is the measure of exercise self-efficacy, or exercise-related confidence. This is a measure that's being used more and more in the Tai Chi literature. And particularly for our elder and deconditioned patients, the thought of initiating an exercise regimen can often be quite daunting. They might have this image of boot camp here and say, how can I possibly do something like that? So for many of these folks, Tai Chi can act as a gentler, non-threatening bridge exercise that builds confidence, builds strength, so that perhaps these patients can then progress to additional activities over time. So as we know, psychosocial factors are incredibly important and relevant in cardiovascular disease. There have been several systematic reviews as well as meta-analyses conducted looking at various psychological outcomes and the effects of Tai Chi. And this is actually from a meta-analysis by Dr. Wang, who's here in the audience, which reported on positive effects of Tai Chi in stress outcomes, anxiety, as well as depression. What about blood pressure in Tai Chi? Well, there have actually been a few relatively small randomized control trials looking specifically at Tai Chi in the management of hypertension. For the most part, these studies have been positive. This particular study here reported decreases in blood pressure, both systolic and diastolic blood pressure, similar in the Tai Chi group compared to the active exercise control group, with reductions of about 7 millimeters of mercury in systolic blood pressure, which is actually similar to what we see clinically with conventional exercise. So very briefly, I just want to take you through a series of 3 studies, and many of you may be familiar with these studies, really just as an example of a progressive approach of how we're trying to better understand Tai Chi as a therapeutic intervention. And these studies, you'll see, each study building upon the information gained from the prior. So when we first started this line of inquiry, the rationale for studying Tai Chi and chronic heart failure was actually fairly clear. Patients with heart failure are often sedentary, they're deconditioned, they suffer from exercise intolerance and are short of breath. Tai Chi, as we said, has multiple components that may actually address many of these issues. In addition, one of the key pathophysiological processes in heart failure is this overdrive of the sympathetic system. And so perhaps Tai Chi, with its meditative components, relaxation, and stress management, that may be addressed as well. So our first study randomized patients with heart failure to either 12 weeks of Tai Chi exercise or to usual care. The Tai Chi Intervention was a 1-hour class that met twice weekly for 12 weeks, and it emphasized 5 basic and key movements modified from the Yang style, and also included Tai Chi warm-ups, stretching, and meditation. And when we compared the change scores from baseline to 12 weeks between the 2 groups, we saw that the Tai Chi group here in the pink improved their disease-specific quality of life score. And here, the lower score is actually favorable. The Tai Chi group also increased their 6-minute walk test, which is a measure of exercise capacity, and also had improvements in their BNP, their serum BNP, which is a biomarker of heart failure severity. But the obvious question was, since our control group was an attention control, were these positive effects that we observed simply due to attention alone? And so this led us to our second study. And this was a larger study where we randomized the patients with heart failure to either 12 weeks of Tai Chi or to 12 weeks of an education attention control. And again, when we compared the change scores from baseline to 12 weeks between the two groups, we saw that the Tai Chi group, again here in pink, increased or improved their disease-specific quality of life. Again, a lower score is actually favorable. They improved their mood. They improved their exercise self-efficacy. They had sustained increases in overall physical activity over the 12 weeks. However, when we compared the two groups in terms of exercise capacity, there was no significant difference between the groups. And so this really led us to think more critically about the physical activity component of the overall Tai Chi intervention, and led us to ask, what's the specific role of aerobic exercise versus the other components in the Tai Chi intervention in affecting change in this population? So this led us to our third study. Again, a pilot study where we randomized patients to either 12 weeks of Tai Chi exercise or to 12 weeks of conventional aerobic exercise. And in this study, we were not just interested in what was going to happen between baseline and 12 weeks between the groups, but we were really interested in acute physiology and trying to find out what's happening in these actual classes and characterizing the intensity of each of the interventions. And so we hooked the patients up to all sorts of machinery, and we measured heart rate and respiratory rate and oxygen consumption and ventilatory efficiency. And what we found was that, not surprisingly, the aerobics group was a measurably higher intensity activity by any of these parameters. And so here again we have a graph of the mean maximum heart rate during exercise class. Again, the Tai Chi group in pink having a lower mean maximal heart rate. And so the Tai Chi was a much less intense physical activity. However, when we looked again from baseline to 12 weeks, exercise capacity actually increased in both of our groups, but more so in the Tai Chi group. Now, of course, this was a very small study and needs replication, but it was provocative, and so this suggested to us that for sure aerobic activity is important, we know this, but there may be other components of the Tai Chi intervention that are just as critical in affecting change. So the last few slides, I just want to give mention to some ongoing studies that we're doing in Tai Chi and another cardiopulmonary population, COPD, or chronic obstructive pulmonary disease. And in many ways, patients with COPD and heart failure are quite similar. They're both a population of elder individuals who are often sedentary, deconditioned, they suffer from exercise intolerance, and are short of breath. And even pathophysiologically, the two diseases share some elements with an increase in inflammation, sympathetic overdrive, and autonomic dysfunction. And so it made sense to apply Tai Chi to this population as well. So in COPD, patients often suffer from this sort of vicious cycle that's well known, the so-called anxiety breathlessness cycle, where patients have COPD-induced shortness of breath, they get very anxious and stressed about it. This causes more shortness of breath, and then they are more deconditioned, and they have more exercise intolerance, more fatigued, and this worsens their COPD, and this cycle continues. And so for these patients, helping them deal with anxiety and stress and breathing retraining we thought would be very, very important. And so we were interested in looking at this specific component, exploring the one key component and isolating meditative breathing from the other components of this multi-component Tai Chi intervention. And so this is an NIH-funded R01 study that we are conducting right now that's doing exactly that, where we have one arm where we've isolated the meditative breathing part from the overall Tai Chi intervention and looking at the specific effects of that. A second NIH-funded R01 is beginning to explore Tai Chi as an exercise maintenance strategy after pulmonary rehabilitation. So we know that for patients with COPD and many other pulmonary populations, pulmonary rehabilitation is actually very helpful. However, compliance is poor, and for the most part, we know that after pulmonary rehabilitation, after the program ends, all the clinical gains pretty much disappear within 6 months because the patients do not continue to exercise. And so how do we keep these patients engaged in exercise over time? So our hypothesis, again, Tai Chi, with its multiple components, has different elements that inherently are similar to what's taught in pulmonary rehabilitation, including upper and lower extremity endurance and strength training, aerobic exercise, and breathing retraining. So our hypothesis was that since Tai Chi may increase exercise self-efficacy and provide psychosocial support, this may facilitate exercise adherence, increase overall activity over time, and this hopefully will translate into improved and maintained clinical outcomes over time. So in the interest of time, I'm going to stop with this slide, but I'll leave you just as with this slide as an illustration of the of other exciting and interesting Tai Chi studies that are going on at Harvard and with others and Harvard collaborators. There's a study of autonomic control of the cardiovascular system during different yogic breathing patterns. A study that Dr. Wayne mentioned looking at healthy aging Tai Chi and specifically at the complexity of heart rate dynamics. Another study of Tai Chi exercise for obesity and cardiovascular risk factors, and a study for Tai Chi in patients with depressive symptoms. So I want to also acknowledge and thank our NIH sponsor who's provided support for many of the studies mentioned. Thank you very much.
Our third speaker is Dr. Helen Langeval. She is the director of the Osher Center for Integrative Therapies at Brigham and Women's Hospital and Harvard Medical School. She is a visiting professor at Harvard Medical School, and she also is professor of neurology, orthopedics, and rehabilitation at the University of Vermont. She's going to talk to us about what are the mechanisms underlying the evidence that we've been hearing about during the last 2 mini lectures, and in particular looking at connective tissue.
Good afternoon. It's a great pleasure to be speaking with this great group in honor of World Tai Chi Day. And I'm going to be talking about something that's a little bit different and related to Tai Chi and to many other types of treatments, and focusing on connective tissue. Now, we've all heard many times already by Dr. Wayne and Dr. Ye that Tai Chi is a multidisciplinary activity that involves many parts, many different components. Ranging from relaxation, mindfulness, retraining of the neuromuscular system, exercise, and stretching. Now, if we think about many of the chronic conditions that Tai Chi may actually benefit, it's very clear when we start thinking about these conditions that these conditions are not simple either and involve many different components. And so it's important to think about a lot of chronic diseases ranging from chronic pain to chronic obstructive pulmonary disease, that there's a lot of times a dual component to these, and we call psychosomatic, in a sense that there's a sort of psychic component, in a sense, emotions, behavior, actions that are actually part of the condition, and the somatic component is the actual physical component of the problem, and that there's an interplay between these different aspects of it. And if we think about it, I like to think about it as in a very dynamic way, in a sense that as we go through life, everything that we do, all of our activities, all of everything that we do, essentially determines the shape that we take on and as we evolve through life. For example, if we have a habit of sitting a certain way, gradually over time our body, our physical body, remodels as a consequence of the way that we sit. And so there's a constant interplay between the activities that we have and the matter, the physical matter of our tissues. And so, and the same thing goes in the other direction. If our bodies remodel a certain way because of certain, say, habits of posture, or we do certain sports, or we use one side of our body more than the other, well, eventually, as our tissues remodel, that influences what we can and cannot do. And so, there's the circle kind of goes in both directions. So. I cannot ever be not reminded of the sort of yin and yang circle when I think about this, because that's essentially what yin and yang sort of theory tells us, is that there's a constant interplay between sort of the active, sort of dynamic aspects of anything in the universe, including human beings, and also the sort of more solid matter-like aspects of, for example, in our bodies, which are, the bones, the muscles, the cells, the tissues, etc., the more dense kind of yin aspects of our nature. And so we can think about it as in that way. And of course, Tai Chi embodies this in a sense that it will have, as both previous speakers pointed out very elegantly, that there's an interplay between the various different aspects of the body that a dynamic and complex intervention such as Tai Chi acts upon. So, for example, relaxation would impact like the autonomic nervous system. Mindfulness will have an effect on sort of the whole regulatory control of the body, and neuromuscular retraining could alter the movement patterns, and as well as both being influenced by the emotions. For example, the fear of falling that Dr. Wade mentioned. Aerobic exercise would have a more direct effect on the cardiovascular tissues, right? The arteries, the heart, the veins, and the stretching component on the musculoskeletal system, right? And so all of this, importantly, is that there's, again, these effects are not independent of each other. That's very important. What I'm going to do in this talk will reflect the interests of my particular lab and research group, which is the effect of stretching. And I'm going to be talking about the effect of stretching on a particular aspect of the body, which is of very interest to us, which is the connective tissue. So this talk from now on is going to focus on very narrowly on one thing, which is the effect of stretching on connective tissue. But again, I want to emphasize that because of this dynamic interplay, it's very clear to us that even though the stretching, for example, may impact connective tissue at a physical level, that's not where it stops, because influencing the structure of the physical body will then carry over into the totality of the individual's function. So stretching, of course, is nothing new, and any of you who have animals at home or observe animals in nature, we can see animals stretch. It's a spontaneous thing, and humans do it too. We do it spontaneously. We stretch because it feels good to stretch. But what exactly happens when we stretch? Besides feeling good, is stretching good for us? And what happens physiologically when we stretch? And if we don't stretch enough, do bad things happen? And if we forget to stretch certain parts of our body, and that can begin pretty soon in childhood, as I notice in my own children. We sometimes forget, and is that not good? And if we injure ourselves and we are not able to stretch, if for whatever reason, for a period of time, what happens? Are these effects? What are the effects of this on the body? And what are the tissues that are stretched when we stretch? We think when we do stretching exercises, a lot of times we think of stretching muscles, like for example, when we have our tight hamstrings that we like to stretch. But there are other tissues, the connective tissues, that are the tissues enveloping the muscles, that go around every structure of the body, not just the muscles, the bones, the nerves, the blood vessels, that also are in the organs, the lungs, the heart, the liver even. There are connective tissues everywhere in the body, and these connective tissues can be more dense, in the sense of densely packed tissues, or they can be looser, what we call areolar tissues, and they really form a network throughout the body. Now, when we have an injury, for example, we can see that the connective tissue remodels and changes as a result of an injury. This is an example here in a mouse model where we have these very thin lines, of blue lines here, of dense connective tissue separated by layers of more loose connective tissue. And when we do, this is a special experimental injury that we look at the effect of, and if you just very, very delicately separate these two layers and then let this is in this case an experimental animal, and then let the two layers heal for 7 days, you see that the two layers become thicker. I'm losing my pointer here. And in some cases they can actually fuse together, and that causes what we call an adhesion or a contracture. Okay, it's essentially a scar inside the body that can prevent the movement of the tissues and range of motion. We became interested in the lab in chronic low back pain and the possible role that connective tissue could play in low back pain. There's a lot of people who suffer from chronic low back pain who do not have X-ray abnormalities or MRI abnormalities of intervertebral disc, for example, diseases, or any indication of where the pain may be coming from. And we're interested in the lab in whether the pain may be coming from the connective tissues on either side of the back of the spine. And we did a study of over 107 subjects who had chronic low back pain and compared them to matched controls. And what we did is we measured the thickness of what's called the thoracolumbar fascia, which is an area, it's a sheet of connective tissue in the back that we can measure with ultrasound. And if we look at this white structure here, that's the thoracolumbar fascia. In some patients, it's a little bit thicker. And then in other patients, you can see it's very thick, and it looks even disorganized. And when we measured the thickness of this area down here, we saw people with low back pain. It was thicker than the controls by about 25% on average. And we also looked what's called the echogenicity, the amount of echoes that are generated by the ultrasound during the exam, and that was increased as well. We also was wondering, if this increase in thickness was also associated with differences in how the connective tissue was mobile. This connective tissue in the thoracolumbar fascia is composed of several layers that all are connected to the muscles with different directions of pull. Some muscles pull longitudinally, up and down, and other muscles pull transversely. So it would make sense that these muscles, these connective tissue layers, would have some independence of motion. And you can actually see these layers here on the ultrasound as these dark bands separating the white bands. And so here we did a test where we asked, instead of just taking an ultrasound image in the human subjects, we asked them to lie on this motorized table, prone, so their head here, feet there, and then what the table does is it flexes like this. So essentially the subjects are bending back and forth passively, okay? And in response to this, we looked, and this is a movie that illustrates how the connective tissue layers here within the thoracolumbar fascia are moving not all at the same rate. You can see that some of these layers here are moving in the contrary direction to the layer immediately above it, and so I hope you can appreciate that at this distance. But so there's a certain amount of what we call shear plane deformation that occurs between these layers. In contrast, this is a subject with chronic low back pain, and the layers don't seem to be moving quite as much. It actually looks like the layers may even be stuck. And this is reminiscent of what we see in the mouse that has had the injury. So we see a decrease in the mobility between the layers. We can actually measure this using a technique called ultrasound elastography, where we can calculate the shear strain separating these layers. And in the patients, this was a study, again, of 116 subjects with low back pain and controls. And we can see that the shear strain, the amount of shear deformation is decreased in the people with low back pain. So there's less movement. So we're wondering, the next question is, well, okay, if this connective tissue could be involved in pain, is it possible that stretching could improve the health of the connective tissue? So we did an experiment in rats where we actually caused inflammation of the connective tissue, because we were wondering if this pathology or thickness that we are observing in the connective tissue in people with chronic low back pain may be due to maybe some kind of chronic inflammation that may actually affect the tissue. And so we were attempting to look at this experimentally by inducing inflammation in this tissue here by injecting an inflammatory substance, and then subjecting the animals to a form of stretch that was actually developed a little empirically in my lab by rats. When you hold them by the tail, and this is very gentle, it's not something that actually doesn't hurt the animal, but we allow the rat to grab onto the edge of the table, and then spontaneously they extend their back feet, and they essentially are stretching their thoracolumbar fascia this way. And it's similar to some poses that in certain yoga type exercises, which is very interesting, I think, that the rats spontaneously adopt this position. And we compared that to an intervention where we're simply taking the animal out of the cage and holding by the tail, but not suspending them. And it's important that the animal is not completely suspended off the ground. They're still able to hold on and be in contact with the ground. And so one of the things that we looked at is how the animal was walking. We can see that the animal that has the carrageenan has a reduced stride length, meaning that it's not walking as much and as well. And the stretching, this is a sham intervention, does not change things, and the stretching completely reestablishes the stride length of the animal back to normal. We also looked at the sensitivity of the animal to touch on the back, and using something called von Frey testing that looks like looked at mechanical sensitivity, and you can see that it's increased with the carrageenan and decreased again with the stretch. So the stretch decreases the amount of sensitivity that the animal has. We also looked at inflammation itself in the back by looking at the amount of inflammatory cells. These are macrophages that indicate the amount of inflammation that there is. And we can see again that the stretching compared with the sham decreases the amount of inflammation in the tissue. So it seems like the stretching is actually helping. Just to show you that we can actually measure this with the ultrasound, similar to what we do in the humans. So I just want to also mention that we're also interested in our lab not just to look at the connective tissues as far as tissues are concerned, but also we want to look deeper into the tissues and look at the cells that are in the tissues called fibroblasts. I don't know if you can see these cells very clearly, but we do experiments where we do some stretching of the animal, both in the animal, a live animal, but also sometimes we take the connective tissue after the animal has been euthanized, and we stretch the piece of tissue in the lab, in a dish essentially, and we look at the response of the fibroblasts. These are the cells that are in the tissue in the connective tissue, and we see that the fibroblasts respond to the stretching by changing shape, and we can measure this, and we can see that the fibroblasts in the stretch tissue are larger and different from the fibroblasts in the non-stretch tissue. And we can see that the stretching and this expansion of the fibroblasts is accompanied by some signaling. This is ATP, which is a signaling molecule, is released into the connective tissue in response to the stretching, and this is one of the mechanisms by which the fibroblasts can change shape. And importantly, ATP is a molecule called a purine, and that has been implicated in sensory signaling and can even be converted to other molecules that may have analgesic effects. So we're very interested in this type of signaling that occurs in the tissue. So, again, I think one thing that I want to mention is I talked about stretching, but we're also interested, of course, in the effects of not stretching. And we have some animal models. Here's an example. We have a pig model at the University of Vermont where we restrict the amount of motion that the animal is able to have by simply connecting a strap to the leg, to a harness. The animals adapt to this very well. They're still able to walk, but they are not able to stretch as much when they walk, and they cannot extend their back leg. And we are interested in looking at the connective tissues of the back to see if they remodel in a similar direction to when people have back pain and the connective tissue thickening and lack of mobility that I showed you earlier. And another important thing that we're interested in, as Dr. Wayne mentioned, is what is the optimal dose of tissue stretch. It's very important to know how much, because if you stretch too much, you can actually injure oneself. And so I think that this is a very important thing, that when we look at a mechanism like this is where we can actually do some dosing studies and see what are the different, how long should we stretch, what should be the amplitude of the stretch, and how often should we do it. Same thing with Tai Chi. By doing sophisticated measurements, it's possible to look at the dose of Tai Chi and look at it at a global level, but also break it down into different components and look at the dose of that. So I'm just going to want to just summarize here by showing how all of the different levels that we can look at kind of ties together. So for example, I've talked about, we've all been talking about Tai Chi today, and I have talked about low back pain, but it could be a number of different conditions here. As far as we looked at integrated function, so an example of integrated function that both Dr. Wayne and myself talked about is gait, right? We looked at gait in the animal, in the rat, but we can also look at gait in using sensors in humans. So this is something that we call a very translational measure, because we can do it across experimental models. Then in terms of in vivo physiological measurements, okay, I've talked about tissue mobility and tissue structure. These are examples of specific types of measurements that can again be done in a translational way in humans and also in animal models. And finally, the last level is I talk about at the cell and tissue level, I talked about the cell signaling, which of course happens very difficult to measure. You cannot measure cell signalings in a live human being, but you can do it in a more focused experimental system. So how do all of these things, and this kind of spiral kind of thing, how do all of these things relate? And I think that this is where we can look at these different levels of research at what's called a translational level, right? We go all the way from a cell culture dish to a tissue to an animal and to a human, and then the job is to integrate all of this and to make sense of it all and to see, obviously, what I've presented it is a very much more narrow view. We also, because I talked about just stretching, and of course Tai Chi is not just stretching, but there is some stretching in Tai Chi. It's one of the components. So we have to now, the job is to integrate that with the other components, and I want to acknowledge the people who've contributed to the research that I have presented, and collaborators, the University of Rochester and Columbia, as well as the funding from the National Center for Complementary and Alternative Medicine. Thank you very much.
So as Julie mentioned, really what we do research for is to make a difference. And when the rubber hits the road, we can actually make a difference in people's lives. Now I'm going to share a little video that some people in this room were part of. It is a joint program that's sponsored by the Beth Israel Deaconess Medical Center's Movement Disorder Center, as well as the OSHA Center at Brigham and Women's Hospital. And it gives you an idea of what goes a little bit further to this translational scheme that Dr. Langeval showed, where this translates out into community programs. But it's bi-directional, because what we're learning in our community programs informs the questions we're asking and the research we pursue. So it's a bi-directional research program. So, thank you.
Learning that I had Parkinson's was devastating. Tai Chi enabled me to build a relationship with my body again.
Tai Chi teaches you how to make your movements more graceful, so I feel more at ease.
When you see your body relaxing, it does make you feel better.
Even up into your upper arm, just kind of gently bowing and stretching. Switch. Parkinson's disease is the second most common neurodegenerative disease after Alzheimer's disease. For some time I've been suggesting Tai Chi as an alternative to conventional physical therapy, as an intervention for people with Parkinson's disease who are experiencing balance difficulty. With a greater awareness of the effectiveness of it, we are recommending it earlier. And even down into your legs and feet and toes. Feel them breathing too.
Tai Chi is commonly referred to as a mind-body exercise, a kind of meditation in motion. It integrates slow, relaxed, circular movements with deep, conscious breathing and a number of cognitive skills like focused attention, whole body awareness, and it uses imagery and visualization. The goal isn't to learn complex sequences of external choreography, but rather we use simple movements that allow people to focus on the core principles that we believe are most therapeutic in Tai Chi.
It engages me in a way I've never been engaged, the kind of movements you do or you don't do in anything else, you don't do in any other sport. What I enjoy so much is the sense of connection to my body, the ease of doing it, and the relaxation and sort of confidence of balance that I feel at the end.
What's cool and different about Tai Chi is the fact that it's very non-stressful and very quiet, very graceful. And what I enjoy mostly about it is that it's converted me to a large extent from being focused on what happens next rather than being mindful of the present.
One of my challenges is I have significant tremors in my left hand and left leg, and the Tai Chi helps to relax the muscles. I notice a benefit right away. Seeing other people with the same similar conditions makes me feel like I'm not alone.
With Parkinson's, there's a reluctance sometimes to be social, and couples suffer. Being together, having fun in some kind of a program like Tai Chi, where both people have a shared experience that is a positive one and even a fun one, is extremely important.
If I have any anxiety about Jim's condition, then it's certainly I'm able to relax. But I think also as a spouse, it's a way that we can support each other and be in a group setting that's safe, and it's just a very nice group of people to be with.
And when she doesn't feel like going backwards anymore, she's going to roll me off to her right, and our hands are going to go roll. And now her hand is
There's a growing body of research evaluating the health benefits of Tai Chi. To date, there's probably more than 150 randomized controlled trials, and there's some good evidence that's emerging from this literature.
And there's one published study that documented that 6 months of twice-a-week Tai Chi with an emphasis on balance was able to improve balance, and they compared those patients to two other groups, some patients that had conventional exercises. And it wasn't even close. The Tai Chi group had benefit that was measurable compared to the non-Tai Chi groups.
All right, very good. Thanks for coming. We'll see you next week.
I'm 5 years into this disease, and I have pretty much no doubt that I'm doing as well as I am because of Tai Chi and all the different movement programs I'm a part of.
I would recommend it completely to anybody who's newly diagnosed or is the spouse of somebody or a friend or a family member of somebody who has Parkinson's, because you'll reap so many benefits. The health benefits and the support system is really fantastic.